doing good. It's a happy hump day. It's a good Wednesday.
Yeah, we've been very busy working on many projects, but today we are actually very honored to have someone that we happen to love. We are blessed because we have so many people
Yeah.
that are so amazing joining us in this mission, right?
And our doctors, the doctors that we have now, we couldn't have asked for anything better. So
Yeah. And talking about doctors, you want
without
to
further
introduce?
ado, so Dr. Neelay Shah is a neurologist, and he is the director of neurology here at Formé. Dr. Shah has been working with us for quite a few years now. He takes care of our patients. Hi, Dr. Shah. He's been
Hey,
taking care of
ladies.
our patients, and we're going to go into, a little bit about who would see a neurologist, as well as what's happening with the people that have suffered from COVID and how that affected your specialty. First, you can do a quick little intro for yourself, Dr. Shah.
Sure. Well, I'm a neurologist. I'm in private practice. I have been working in the area for years. I did my training at Mount Sinai Medical Center, followed by a fellowship in the University of Pittsburgh. Currently, in addition to working with you folks at Formé Urgent Care, I have a private practice in New Jersey, and I cover the stroke service at the Wyckoff Heights Medical Center in Bushwick, Brooklyn. So that hospital, in case you don't remember, had the first COVID death in the New York, New Jersey area, and until very recently was still almost 100% COVID. And so all the patients had all their regular diseases plus COVID infections, which complicated everything a lot more. And we learned a lot in our experiences through that as far as how it affects neurology and the neurologic systems. I happen to be a general neurologist with an interest in MS and epilepsy. I sit on the board for the National MS Society here in the New York area, as well as the New York State Neurologic Society board. With regards to neurology, as a general neurologist, what I like to see and treat is all sorts of conditions that relate to the brain and the spinal cord. What that means is headaches, blackout episodes, seizures, dementia, memory problems, strokes, and diseases that you may have heard of, such as Parkinson's disease, multiple sclerosis, myasthenia gravis, and other issues that affect the brain and the muscles. So it's been a challenging time because the way this virus works has been so interesting from an academic perspective. Yes, if you get the virus in you personally, it sucks. I don't deny that. But as a physician, I'm always learning. And what we've learned from this disease is that the nervous system really can be affected by a virus in so many ways. Like I had a young 20-something-year-old guy with no family history of anything come in, and he looked like he had really long-standing bad Parkinson's disease, shaking and stooped over and stiff. And the only thing we could trace that was different is that he had been infected with the COVID virus. It's incredible how these things happen. And we've seen a lot of people have strokes, even at the young and early ages of 30s and 40s and 50s, because the blood vessels block up with blood clots from this virus. So there's a lot of things that we've learned more about neurology because of how the virus is affecting the nervous system. But what we can offer at Formé Urgent Care is pretty much a full gamut of services in terms of covering neurology. So if there's anything going on with the nervous system, whether it's with the brain, the muscles, the nerves, tingling in the fingers or toes, we luckily do have the resources to do just about every test that you'd get at any other medical center, from nerve testing to electrographic EEG testing, ordering the right MRIs, CAT scans, and so on and so forth. Our goal, I've been working with you for years now, is to really try and dig down to the bottom of the problem. And once we get to an idea of what's causing the issue, then solving it, not just covering it up. Any doctor can just throw pills at you, say, here, this will make you feel better, come back in a month or 2 months. But more important is let's see if we can figure out what is the cause, how we can actually fix it and make it better so that you don't have to live with the problem anymore. That's our approach, and that's what makes it so fun working with the whole gang at Formé.
Well, I can tell you that, Marjorie, thank you. Thank you for watching. It's always so nice to get comments from you
That's
guys.
Dr. Shaw's wife, by the way.
Dr. Shah's wife.
Bad.
That's a good wife. She's supporting you. Well, thank you
That's right.
anyway for the comment. Dr. Shah, we really thank you for the work that you've been doing. Like you say, you've been with us for quite a few years, and you've been there for the community in so many different ways. And I have to say that lately, through the COVID experience, when we were at the highest, there was a specific person, Marcelo Rodriguez, and we can say his name because he actually wrote a beautiful article about Formé and about you, the support that you gave him. And I remember calling you and saying, we have a patient, he doesn't have insurance, and you were like, I don't care, I will be there, I'll support him. And immediately you got on the phone with him, and eventually, you guided him to go to the hospital because you were just talking about that 20-year-old patient. And I remember when I first saw my friend come here, he came to get the COVID testing done, and he was shaking, and I couldn't believe that that was him. He looked like it. He was walking like an old
Wow.
man, and it was shocking to me. And I said, I immediately called you, and you started talking to him, and you took care of him, and you guided him, and he ended up in the hospital, and he went through a hard time, and is still recovering because of COVID.
Yeah.
So, thank you
Yeah,
for
I
that.
think
And go ahead.
no, I think that the pandemic reminded us as a community that we really have to help each other, and if we don't, then it's all or none. We take care of everybody, or we're all done for. That's the reality of why we're saying everybody needs to wear a mask, social distancing, and all these rules that the scientists have come up with. It's really just for the protection of everyone, and this pandemic reminded us. I think that you ladies have set up a mission for Formé Urgent Care, where you've always, from day one, said, we help every member of our society. And you went through so many creative ways to figure out how we can help the uninsured. And I think that healthcare is very expensive and it's a challenge. And it's a darn shame that in this country, one of the richest countries in the world, so many people don't have access to healthcare. And that's one of the challenges which Formé, with its partners in the community as well as in the insurance community, is really overcoming. And that's something that really excites me and why I love working with you folks, because people that don't have insurance, that can't afford $1,000, $2,000, $3,000 insurance premiums every month, can join up with us and still get world-class quality care. And I think that's a testament to what work we and you ladies are doing and how we should be as a society for every single person.
And we've been very lucky, Dr. Shaw, to have a doctor like yourself and Dr. Middleton and now Dr. Gonzalez.
Gonzalez, our
We
cardiologist.
really have doctors that care. And really, I mean, because it's not like we can compete with the hospitals and pay them the money the hospitals are being paid, are paying them, but they're coming here because of the mission. They're coming here because we are going above and beyond and thinking outside the box of how to help the community. And they are total team players. They're team players, and they have the same feeling of giving back the way you do. And I mean, yours just shine. You just shine, and we are so appreciative of that because you don't realize how many people need to see a neurologist, and how many people don't even realize that how expensive it would be if they went outside just to see a neurologist. I
Yeah.
mean, a consultation could cost them $1,000 or $600 to $1,000. So we love you. We appreciate you.
So let's
Yeah.
talk a little
No.
bit about neurology. I have a question, and you can guide me. This question might be, I have somebody, it might not be for you, but I'm thinking that it might. Somebody that's sweating a lot under the armpit and I know they use Botox for, the headaches, and I want you to talk about that, but can you use Botox for the armpits that sweat a lot? And is that something that you would do or a dermatologist?
Yeah, so that's a great question. And yes, it's directly related to the nerves being overactive and pushing out sweat. Hyper, there's a term for it, hyperhidrosis. I apologize. And what that means is that you.
Oh, we lost you.
We lost him.
There he is. He's back.
We're back. Thank God.
Okay.
Oh, we can hear you. You need to refresh. Okay, no problem. We have technical issues are part of the new era of
uh, yeah,
virtual,
Can
our
you hear
virtual
me
virtual
now?
meeting.
world.
Yeah,
We can
perfect.
hear you now. Excellent.
Gotcha. Sorry about that. So yeah, excess sweat in an area of the body that you don't want it to be is a problem. It can happen under the armpits, it can happen in the palms of the hand, or any random patch of the body. And so what we do is the nerves that are stimulating that, we kill them off temporarily with Botox or botulinum toxin. And what you do is you do lots of little injections in that area with a tiny needle, so it doesn't hurt that much. But what it does is it kills off those nerve endings. They can regrow in 3 to 6 months, but at least you don't have any other side effects, such as with medications or creams that you would otherwise try to use that can affect the entire body. So it's a very good targeted treatment. Some neurologists do it, many dermatologists do it. I personally don't inject Botox for this condition, but certainly can find somebody that can do it for patients that need it.
And do you do it for headaches though? Do you
Yes,
find that you do that? You do.
How does that
absolutely.
work
So
for the
for
headaches?
headaches, basically we have so many different medications now available for headaches. When it comes to headaches and migraines, many of them are not fully understood, meaning we do all sorts of testing like an MRI or a CAT scan, and everything is normal. And that can be frustrating if you're in pain and suffering for many days every month or many days every week. We have a number of different medications, different pills that you can try. There's also a new class of medications called CGRP antagonist medications. These medications are relatively new, only came out in the last year or two, and they target a very specific protein receptor on the brain surface, and it blocks the pain. That whole class of medications, there's about 4 or 5 drugs now available, which can be used as an injection once a month anywhere, just like in the leg or in the arm, once a month injection. So that's a whole new area that has come out recently with tremendous success and very few side effects. However, if all of these things fail, you can also kill off some of the nerve endings in the head, giving injections for Botox in the forehead, above and between the eyes. You can go behind and above the ears, or even in the back of the head. And Botox injections in those areas can numb up and kill off those nerves that.
Hmm? I keep losing
Oh,
them. Oh,
okay. See, we have to make sure
he needs
we.
to go on do not disturb. We need to show him do not
I'm
disturb.
on call for the hospital, and so
Oh, I
there
see.
must be
Oh,
Okay,
something.
great.
then we forgive you. We'll
Uh,
entertain everybody when that happens.
So when they call, I'll pick up on my phone and not my iPad. But
Okay.
No
Botox
problem.
injections for the head can be very effective, but they do have to be done over and over again every 3 to 6 months, depending on how bad your headaches are, because those nerve endings can regrow. And that is something that we can do. We have to jump through a few hoops to get insurance to pay for it. But if we can show that you've tried and failed many different medications, they often do then pass and approve it and pay for it.
And you were talking about numbing in the hands and feet. Like, is does that include like when someone like myself who suffers from um, my legs cramp at night? Is that neurological or is that muscular? I don't think it's muscular because
So that
it's
there's
just at night.
two separate issues there. So when your legs feel weird at nighttime, when you're resting, they feel uncomfortable. That's
Right.
often known as restless leg syndrome. And restless leg syndrome can be helped with medications. Oftentimes, people use the same medications that they use for Parkinson's disease to help calm down those nerves and make them feel better. However, before you do that, many patients do benefit simply from vitamins. It's often related to maybe a mild iron deficiency plus
Oh,
some B vitamins. And I would always go the natural route and try that because it doesn't hurt before we move forward to trying some stronger drugs. As far as numbness and tingling, that can happen in the feet or in the hands and is known as neuropathy. And neuropathy happens for many different causes. The most common being diabetes. When you have diabetes, the inflammation from the extra blood sugar levels can cause damage to the small nerve fibers. And that can then cause it to be feeling numb or tingling or painful, even. And it can get worse over time. However, it is reversible. And again, the best approach for that is correcting the underlying condition. So if it's a diabetes problem, getting better diabetes control. If it's a thyroid issue, taking that under control. Vitamin deficiencies, correcting those. So there's different ways depending on the underlying cause, and that we can easily figure out through a series of some blood tests and nerve conduction studies and EMG testing, which we do offer at Formé Urgent Care.
Well, that's what I need to do because my hands fall asleep at night. My hands fall asleep so badly that I have to rub them. I mean, all night long. I suffer. Even if I lay them flat and I'm not laying on them all the time. So we need to do some
And
testing.
that could be carpal tunnel syndrome for all we know, because when it comes to the hands, especially at night, what happens is the nerves get inflamed in the wrist. And when you're sleeping, whether you realize it or not, you may be flexing your wrist a little bit and pinching the nerve more and getting it even worse. So
Okay.
wearing a wrist splint that just cocks it back a little bit could fix it. But electrical testing, nerve testing, can give us the solution in terms of what is causing it, how bad the damage is it reversible, will it need surgery at a worst case scenario, or can we help it with medicines, physical therapy, occupational therapy, vitamins, and more minimally invasive approaches.
I mean,
So
I'm gonna
let's
be
schedule you for Friday.
I'll be there.
One of the advantages of owning a medical center
Is
and
I get
urgent
access
care
to all of
is
you.
we have access to the doctors.
Yeah.
Definitely a
Yeah,
plus.
love it.
Dr. Shah, I want to talk about dementia because one of the biggest concern is during this pandemic that, especially the elderly, they're secluded. There are no families are able to go and see them. Many of them are in their rooms, and the ones that are positive for COVID or that have been positive for COVID, they have to stay in the room and they're already dealing with dementia. So my question to you, are you seeing more cases of dementia, and are they getting worse? And then the last question is, what can the family do to help?
That's a great question. And yes, it's been many problems happening through the pandemic, and dementia has gotten worse for several reasons. One, actual encephalopathy or dementia like processes and changes in the mind from COVID itself can cause dementia. So I've younger people coming in with memory problems, confusion, episodes that really mimic dementia, and it's secondary to the COVID virus infection. However, in patients that already have dementia, one of the mainstays of therapy, besides the medications, one of the things that we say really helps maintain the brain is social interaction. And if you're isolating out of safety concerns, then you're not getting the day-to-day interactions or conversations that you were able to have, or join those groups such as church groups or other social groups, daycare centers that would provide them and things like that. The brain goes downhill faster. And that has been a challenge. Actually, literally right before I joined you guys on this call, I was seeing a patient who, with his wife, has been treating his dementia in part by going to his church and being part of many different groups. So I said, okay, sir, what are you doing now for your church groups? And he said, Zoom. So he is, with the help of his wife, getting online and still having conversations and keeping up with interactions with some of his church group members. It's not a full replacement for the social activity and interactions that really help the brain, but it's a start. Video chatting has made a tremendous benefit for patients that are physically isolated and that can't get out for traveling for whatever reasons. It does have a benefit because you could still get the voice, get the nuances of conversation. You can still see the facial expressions. And the technology is very inexpensive and easily accessible for most people now. So using that to our advantage with the help of family members, because some people may not be able to do the technology themselves, but they can sit down in front of a screen, and then when they see someone they recognize, that can make the difference. So that is one of the approaches I would say. But yes, it's been a challenge because the pandemic has really forced people to isolate out of safety and fear and concerns of possible infection.
So you're saying that the COVID infection actually could trigger this disease? It could
Well,
trigger dementia?
it mimics dementia in the sense that it causes inflammation and damage. And then you see patients that are, you know, 30, 40, 50 years old, or even some 20-year-olds that come in and you're like doing the medical testing on them, like memory testing or asking them questions. And they look just like a 95-year-old demented patient in
Wow.
how they're acting and how they're speaking and how they're thinking. And that's a real scary and darn shame.
It's crazy. It's crazy how many things we're finding that this virus is
Yeah.
causing. I
But
didn't even know
Yep.
about that.
do you think that's reversible, or it could be permanent?
Um, I've had the good fortune of seeing the brain be tremendous at healing. So my hope is that these cases that we're seeing caused by the virus are temporary and can heal to a certain extent, but we have no way of predicting in any one individual case by case how much they will heal or recover. But given that the infection, hopefully it's a one-time hit to the brain, unlike standard dementia where it's an ongoing negative process. So my hope is that one hit, it's kind of like a stroke almost in the sense that it affected the brain, but now we have a chance to heal and grow back. So we shall see. This fall, actually, I'm chairing a seminar at the New York State Neurological Society's annual meeting where we're going to have the heads of neurology departments of Cornell, Columbia, and I believe Mount Sinai. And on that panel, we're going to talk all about all the different neurologic things that they saw in these major medical centers due to COVID. So we'll get some insights from them as well.
One of the questions that a lot of people ask, and even when we have family members that we see that they're forgetting things, like Gina and I, we joke around. What we have senior moments. So how do you differentiate from senior moments to actually having dementia or Alzheimer's?
I'm sorry, it's dementia. No, I'm just kidding.
Guys, so if we come to you and Gina and I forget who we
you
are, now you
forgive
know.
us. Which happens often.
Be gentle
Yeah,
with us.
the doctor said so. So what it really comes down to is we find that one of the biggest areas of cognitive issues or mild cognitive impairment, where you feel like you have a little dementia, some short-term memory problems, trouble picking up right away. You used to be very quick and sharp and now you're a little slow, or takes a minute to remember a word. All of that falls under the area of mild cognitive impairment. And the main cause that I see in younger people without any other history is stress, anxiety, or depression. Right now, everybody has a reason to be stressed or anxious, and all of us are under a lot more stress in terms of trying to get stuff done, caring for family, getting work, trying to do it online, and making all these changes to our normal routines of life. And that really does put a lot of pressure on the brain so that it does not work as efficiently as it normally can to recall and remember things. However, it's completely reversible. When you start to get rid of some of those stressors and handle that stress, one of the ways I say is start to exercise regularly, get that physical activity going. Number two is start to meditate. They did clinical trials at major medical institutions in this country that showed 21 days of meditation can change brain chemistry. And I'm not saying join a cult or anything like that. Literally 10 minutes of meditation using one of the free apps available on your smartphone can do the trick. 10 minutes of focused breathing, relaxation a day can really help how you deal with stress, anxiety, and can help bring the brain back in terms of that dementia that you think you're starting to have. So there's a lot of reversible causes of memory problems. It's best to get a medical evaluation. Sometimes simple things like a little abnormality in your blood levels of certain vitamins or your thyroid can trigger these problems and are easily correctable as well. So it's a good idea to get a standard workup, and that's something that we do at Formé. People come into to our clinic very regularly saying I'm having memory problems, and we do blood tests. We do an MRI or an EEG, CAT scan of the head, and we take a look to see what may be in play. And if there's something else at play, such as a medical issue that can be corrected, then once that is corrected, a few weeks later, the brain usually follows and gets better too.
Interesting.
Question. This is more of a philosophical question. What do you think of COVID? Where are we heading with COVID?
That's a tough question. I think that, we dealt with this as humanity 100 years ago. And at least part of me likes to believe that it's the earth, it's Mother Earth, telling us humans to just stop being bad humans and forcing us to clean up the environment by stopping all this polluting activity, stopping all this craziness, living go, 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 and forcing us to shut down. But what it really reminds us is that, all of us have to work together to keep us all safe. So yeah, you may get the virus and it may not affect you that much because you're young and you're healthy, but then you spread it to somebody else and that could be a real problem. You could kill somebody that way. But I have a good friend, an Olympic athlete, 30-something-year-old young mother, got COVID in the White Plains neighborhood. 2 months later, I'm still talking to her on the phone, and just after a sentence, she's short of breath. And this is somebody that had no medical problems at all, super healthy, Olympic level athlete, trainer, personal, trainer and all that, who still to this day, 2 months after the infection was cured, is still having a hard time breathing. So the long-term effects on her lungs are really scary, and we don't know what's going to happen. So I think that as a society, this is just another reminder that we really have to take care of each other. And they say, first wave, second wave. I'm not sure that we're going to see that dip before the second wave. And we'll see how it really plays out. But it could just be that, we're at a steady state, slightly higher right now, until maybe even as long as next spring before it really gets under control through changes in the environment, changes of our understanding of how the disease works, as well as medications, treatments, and a vaccine, which, are under development, but will take a while to get enough production levels out so that, we can vaccinate all the people that are at risk. So it's a tricky question because philosophically, I think that part of it is, Mother Nature's reminder for us to figure out our act and get our act together and be better to Mother Earth and not pollute it as much and not be so crazy about being active and polluting and all of that. But also as a society, humanity as a species, we really have to remember that, it takes a village to take care of a village, and we can't just be selfish individuals. We have to worry about our fellow man. And, all this politics that have been injected into this conversation are just garbage, and they piss me off a little bit. I think that we really should just listen to the actual science and let the scientists do their work and do their research and not have policy and politics mix in this. I think that we're hurting each other for votes and for unnecessary power grabs that are meaningless in the big picture. I think that we are very smart as a species, and we will beat this. But it's going to take time, and it's really going to take a lot of love of each other and respect for each other as an entire species. I'll get off
I
my
think you need to
soapbox now.
speak to all. I think you need to speak to all the young people because you made so much sense. And I wish that we had listeners that were young because it's the young population who think that they're not gonna that they can just do what they want. They're not gonna get sick, but they're not thinking about the person that they're next to. And that's what's happening with the place closing down again.
And with the infection rate being so high because it spread so easily, sure, maybe only 0.01% of people get sick from it. But if you're in that 0.01%, it's 100% for you. So you could be young and suddenly you've lost your lungs. It sucks for you. Even if it's only 1 in 1,000 young people that get sick. If you happen to be that 1 in 1,000, it's 100% for you. So for many reasons, I think that we really do have to be much more cautious and caring for each other.
And I know we have to go, but I heard a comment on CNN that there are places that are having COVID party. Have you heard of this?
No.
Where they know that you are infected and the other people want to get infected, so they're having a party to get infected.
Why?
Have you heard of this?
Why would they do that?
Yeah, I mean, there's
Because
a big popular meme on Facebook right now going around of an unfortunate 30-something-year-old man that went to a COVID party, and he was joking about it. And in the four panels, the fourth panel reports that he's dead now. So again, you can have that COVID party and you can get infected, and let's say only one person out of 50 gets infected, and the other 49 are now immune to COVID. That one person's dead. So that's just terrible. And in the other 49, we don't know the long-term effects of this virus. So the possibility is now you're immune to it, but what if there's a mutation and 2 months later you get infected by that mutated version? It didn't do anything. It didn't protect you. It doesn't help you in any way, shape, or form. It's irresponsible. There's no scientific basis to it. I mean, at the end of the day, it's just plain dumb. COVID parties are just dumb. You got to avoid it, avoid getting infected, and try to just really protect yourselves and the ones you love and all those around you.
And one more question though. Did you hear that the people that are infected or were infected are getting sick again worse? And this came to me from one of my family members who heard it on the news or read it in the paper that they found that people that were infected that went through the virus, that the virus was sitting dormant in them, and then they got it again and it was worse. And then it was a third time for a few people, and respirators. And so it made me nervous because I had the virus and supposedly I'm immune, but and she's like, please be careful. But I was like, I never heard that before, Con, and I'll have to figure out, and ask my docs.
Have you heard of that?
Yeah. Yes. No, actually, I'm a member of a couple of different physician groups, international physician groups that discuss COVID and COVID infections. And rarely we are seeing reinfections in people that are clearly infected, diagnosed, cured of it, and then get several months down the line reinfected one way or another. And the disease seems to be much worse the second time around. Maybe because now the resilience and the resistance is lower. All the systems that normally protect you, instead of being at 100%, they're now at 50 or 60%. So the second time the virus comes through, the damage is much worse. So it's certainly possible. We do only have case reports so far. As we learn, we'll see more studies and more trials to give us hard and fast data. But I have seen case reports to that.
So
we lost them just when we're ending.
And actually, to that end means that even people like me needs to be a little bit less cautious and a little bit more careful.
Yeah.
Well, we were just saying we lost you. Tell them we are finishing up.
Yeah.
We are extremely happy that you were able to join us. The information you gave is valuable. I think we had an incredible conversation. I'm sure a lot of people had some of the questions that we asked you. We want to thank you so much for your support and always supporting us with Formé and our show. And you'll be a guest very soon.
Again.
So thanks you. And by the way, everyone, if you like the show,
remember to like us.
Like us. Take care, Dr.
Bye,
Shah.
Thanks, ladies. Take care. Bye.
Bye-bye.
Go be a doctor. Bye-bye.